why would we not want a public option?
Well, let's take a look at what we do know. My concern is a public, or what I to consider a government takeover of health care,
right.
is going to make it very challenging. But it's not a government takeover,
Senator. That's not fair, and we both know it. It's not a government takeover, because what it would be is a government option. If you have insurance now and you like it, you can keep it. If you want the government option, a government-run, paid for by those who buy it, government-run option to try to keep costs down. That's not a government takeover, if we're being fair, is it, Senator?
Well, take a look. Well, compare it to Medicare, which we know right now is going bankrupt, and I see the same thing happening there. You're going to get huge subsidies.
Over the last 10 years, health care costs in America have skyrocketed. Regular folks cannot afford it. So they tax the system by not getting preventative medicine. They go to the emergency room and are at a last case, and we all end up paying for it. As the costs have gone up, the insurance industry's profits, on average, have gone up more than 350%. And it's the insurance companies which have paid and have contributed to senators and congressmen on both sides of the aisle, to the point where now we can't get what all concerned on Capitol Hill seem to believe, and what more than 60% of Americans say they support, is a public option. This has been an enormous win for the healthcare industry. That is an unquestioned fact. But I wonder what happens for the American people when we come out with legislation now which requires everyone to have health care insurance, or many more people, but does not give a public option. Therefore, millions more people will have to buy insurance from the very corporations that are overcharging us and whose profits have gone up 350% in the last 10 years. It seems like we, the people, are the ones who are getting the shaft here.
And we're not even allowing the people of America to read the bill or know what it costs. You're absolutely right. I'm not going to defend the insurance companies. I've been fighting them for the last 25 years of practicing medicine.
But every vote against the public option is a vote for the insurance companies, sir.
No, it's not. No, I disagree with you.
How can you disagree with that? It is the public option which would keep costs in check, which would keep prices in check, which would stop the big corporations, which have made 350% improvements in their profits over the last 10 years. A public option would stop it. What else would stop it?
I don't believe that. I don't believe that at all, and that's why they can't even get the 60 votes, as Senator Baucus said, for it.
How do we keep the costs down without a public option?
There is no one single magic bullet, but as I just said, let people buy across state lines, let people write off get the same tax breaks that the big companies do, deal with this abusive lawsuits, which is $200 billion a year in unnecessary tests that don't help anybody get well, but they help protect doctors in case they happen to be named in a lawsuit. Let small groups band together. I mean, there are a number of things that we can do to get. There's no one single solution to the whole thing. We need to do all of these things. And then the waste and the fraud and the abuse in this system is just awful. And Medicare, the government-run programs, have the most waste and the most fraud and the most abuse in those systems.
I want to make clear, this wouldn't be Washington running the system, Senator. It would be a government-run plan paid for by the people who sign up for the plan. Yes, paid for by the people who sign up for the plan, a not-for-profit to try to keep health care costs down. And that's what, in recent polls, more than 60% of Americans say they favor.
Everybody, 100% of Americans want to keep the cost down, and so do I. That's what I've been working for by the medical director of something called the Wyoming Health Fairs, to give people positive incentives to get their costs down and stay healthy. These bills don't do any of those things to give the incentives to people and control of people of their own lives. We know half of the money we spend in this country on health care is on just 5% of the people. And those are the people that eat too much, exercise too little, and smoke. And the more we can do to put the incentives in the right direction, Shep, the better it's going to be for the entire system. Then there's going to be enough money for all the other things.